Hi, Mount Vernon. This is Mayor Shawyn Patterson-Howard, and we're here with your Wednesday night update. Tonight, we are going to be giving an update on COVID in Mount Vernon, talk about what's happening with COVID locally and nationally. We have a special guest with us tonight, Miss Beverly Hutchins, and she will be joining us. Beverly's son had the COVID inflammatory disease, and we'll talk about that more later. He's 8 years old, and he was in the hospital for quite a long time. He is a miracle young man. We call him the Wonder Boy, and he will be coming home in the next few days. So she wants to kind of share her experience so parents also understand what this is all about. And in about 10 minutes, we will also be joined by our Chief of Fire, Chief Robert Odindo, and he is the Incident Command Director for our COVID response since February, and he's going to have a lot of good information. And then we're also going to talk about Mount Vernon Hospital and what's happening with Mount Vernon Hospital and how that is going to impact us with COVID. We're going to ask if you take a moment to please share this live. Please share this live with your friends and your family, so that people can see what's going on and participate. And we ask that if you have questions, please put the questions on Facebook Live as well, and we will try and get to as many questions as we can while we are live. And questions that we don't get to as we are live, then we will absolutely answer those questions after we get off the air. So please. Okay, I can't find my live yet. Am I really live then? Because it's not on my page. Here we go. Now there it is. I just found it. So I'm going to share this. I'm going to start a watch party. Here we are. Okay, there we go. So like I said, this is Mayor Howard. It is July 1st. We are 6 months now into our administration, and 4 of it has been COVID focused. COVID became a major issue in our community at the end of February. We experienced our peak. We experienced our peak of COVID infections on about April 6th here in the city of Mount Vernon. We had 164 positive cases that day. So at the beginning of COVID, none of us really knew what it was. We were hearing about it on the news. New Rochelle got hit. And right after that, our whole region turned into a hotbed of COVID activity. We had to respond immediately with very little information. You heard things like an abundance of caution, taking every precaution, other words like social distancing and personal protective equipment. All of those things were introduced, but we all quickly became kind of experts in COVID and how to reduce the rate of infection in our area. As of now, we are at about 2,700 cases. We are down to about 2 positive cases of COVID a day. And like I said, at the height around April 6th, we had 164 people test positive that day. And for the past 30 days, we've been averaging about 2 people a day on average being positive. And so what does that mean? It means that we have flattened the curve, but what it also means is that COVID is still alive and well. We began seeing businesses reopen about 7 weeks ago. In phase 1, we had construction reopen, and we had retail stores able to do curbside service. In phase 2, we saw outside dining open. We saw beauty salons and barbershops reopen. We saw retail businesses open fully, but not malls yet. So little individual stores, we saw those open. And then we saw in phase 3, nail salons, tattoo parlors, other personal massage parlors open. We saw restaurants open fully for in-person and in-restaurant dining at half capacity. And we've continuously really encouraged people to continue to wear your personal protective equipment, continue to wash your hands, continue to practice social distancing. So while we have definitely enjoyed a reduction in the cases of COVID in Mount Vernon, in Westchester, in New York, we have to understand that this is not over. Just because the warm weather is here, COVID is not a flu. So it's not like, oh, it was COVID season and now COVID season is over because the warm weather is here. And we have to realize that just because you're able to take off your coats and your jackets and wear shorts doesn't mean that we can take off our masks, doesn't mean that social distancing is no longer important. We have to be more vigilant than ever. If you're looking at Florida, South Carolina, North Carolina, Georgia, now even as far north as Delaware, California, just all over the country right now, they're seeing such spikes in their COVID cases. And they're seeing spikes in COVID in people under the age of 40, people who are hanging out at restaurants, who are hanging out at bars, who are going to beaches, who are having parties, who are having backyard parties. And Mount Vernon, we know that a lot of people are having backyard parties. We can't jump in and raid your backyard, but we have to make you understand that you are really putting yourself, your guests, and your community at risk. We have worked far too hard for the past 4 months to really reduce COVID in our community, for us to really relax our standards now. If these cases begin to spike, then we're going to see the businesses close again. We're going to see more people laid off. We're going to go back into quarantine status. And I'm sure this time Governor Cuomo is going to be much stricter in his approach as to how much we're going to shut down, because no one wants to see the type of spikes that we had in March and April and early May. We've worked too hard. While we're waiting on our chief to come in, I really kind of want to bring in Miss Beverly Hutchins. And as I stated before, she is our guest here today. And Beverly is the mother of Jordan, age 8. And she also is the mom of Jalen, who is a high school graduate. So we want to give a shout out to Jalen. He just graduated from high school. He's preparing to go to college, and he's celebrating his life. But Beverly, if you could just share with us Jordan's story.
Jordan's story.
Share with us Jordan's story. Tell us about Jordan.
Well, Jordan, he goes to Our Lady Victory Elementary School in Mount Vernon, and he's in the 3rd grade. And he is extremely smart. He's an extremely smart, intelligent boy. And I'm thankful for that because, and I'm thankful that I talk to him constantly because when this all started, it was Friday, May 15th. He started with a temperature of 104. And, I figured, okay, let's see, let's work this out. Let's see what happens. In the back of my mind, I was thinking COVID because I had it. My husband had it. And my oldest son, Jalen, had it. And, we quarantined, we kept away. And he's so funny because when I received my test that it was positive, Jordan told me, Mom, I think you need to leave the home. I think you need to go somewhere and stay, away from everyone. And, at 8-year-olds to tell me that, and I told him, just please get out my room and leave me alone. So this all started on the 15th, which was a Friday. He had a temperature of 104. I called his pediatrician and, she told me, monitor him, keep him hydrated, give him Tylenol every 4 hours, between Tylenol and Motrin. And if you see certain things, she told me, if he starts to get rashes over his body, if his eyes start to turn red, take him to the emergency room. That's what she told me. Actually, she told me, take him to Westchester Medical because that's where she's affiliated. And, Friday, Saturday, he just maintained this 104 temperature every single day. It would go down to about 101, but when the medication, the Tylenol, wore off, it would spike back up to 104. It wasn't until Sunday that he lost his appetite. and he threw up. But that was it. Monday, the 18th, I had a doctor's appointment because I was still struggling with a cough that lasted for like a month. And I went to my pulmonologist. So on my way back home, I just called to see how he was doing. And he said he was fine. When I got home, I went looking for him to check his temperature again because I constantly was checking his temperature. And I said, "Come lay down with mommy." And he said to me, "Okay, but it's hard for me to breathe when I lay down." And
Wow.
at that moment is when I said, "Let's go to the hospital." And so I rushed him to Westchester Medical Center, Maria Ferrer's Children's Hospital. And that's when the nightmare began. And, they put him on oxygen immediately, and they said, we're just going to keep him overnight, just to keep an eye on him and let's see, what happens. And so we stayed. We stayed overnight, and they woke me up at 6 in the morning, 6 o'clock Tuesday morning, and basically told me, "You have to sign these papers because we need to put Jordan on a ventilator because he is not doing well." And I'm trying to process what's happening. What do you mean you need to put him on a ventilator? You know, at let me just back up. When we got to the hospital that evening, and I was looking at him, that's when I noticed his eyes were bloodshot red. Before it wasn't. And I have video of that, and it was just amazing to me. So, you know, that Tuesday morning, he was on a ventilator at 8 o'clock. By 8 o'clock that morning, and by Tuesday afternoon, they told me they have to put him on an ECMO machine, which is basically a bypass machine because his heart was failing and his lungs, everything was failing. Everything was just one by one failing. And, you know,
And as you said, for those who just joined in, Jordan's 8,
he's 8 years old.
8 years
He
old.
had,
Ventilator,
they kept
bypass
asking
machine.
me, does he have any underlying conditions? No, he's a healthy 8-year-old boy. He's nothing. He's never nothing. Just everything he was perfectly born. He nothing was wrong. Nothing. And so I had to sign tons and tons of papers. And, I had 5, 6 doctors talking to me, telling me what this is, what the possibilities could be. But if we don't do this, then the end result would be he will not make it. And by the end of the evening, my son was on a ventilator and an ECMO. And he didn't have to be on both, but they wanted him to be on both. And that's what they kept him on that.
They wanted to give his body a break.
Correct. So, and that's what they said. We got to give his heart, his lungs, we got to give everything a break because it is working. His heart was working 3 times the amount that it should for his age. And
You're sharing a picture of Jordan because we want
yes,
everyone to see, Jordan's
yeah,
just a normal boy,
yeah,
a normal 8 year
and
old.
yes, and my husband wasn't there, so they called my husband. And this is what kind of scared me. They had said absolutely only one parent at a time. We cannot have 2 parents in here. But they said you need to call your husband. He needs to be here. And I said okay. They said because there's decisions that needs to be made. And I'm thinking, well, I just made 2 of the biggest decisions: one to put him on a ventilator, one to have this ECMO machine on him. And they said okay. And then this was Tuesday night. Wednesday morning, they come to me again and says we have to do emergency heart surgery on Jordan because his heart, one valve, the valve on the right was not pumping the blood to the left. It was actually pumping the blood into the lungs. And so we have to operate so that the heart can pump the blood into the direction it needs to go. And to see 20 doctors, it was like 20 doctors. You have the ECMO specialist, the EEG specialist, the cardiologist, the surgeon. I mean, all these doctors to move this little body with all these things hooked up to him to another room for this major surgery was just, I was beside myself. You know, you're seeing this happening, but you can't, you think you're dreaming. You know, I felt like I was in a fog. And, you know, they're telling me, you know, it's a surgery they do all the time. But, you know, it is major surgery and anything could happen. Of course, I'm thinking to myself, you know, anything can happen. Okay, what does that mean? Anything can happen, you know? And so they took my baby away and they said it's a 45-minute procedure, but because of everything he's hooked up to, it'll take about 2 hours, 2.5 hours. And they did. The surgery was successful. Immediately, they knew immediately that the surgery was successful. And, you know, now it was a battle for him to fight for his body to just, you know, do what it can do. They kept him, they told me that they didn't want to keep him on ECMO very long because it causes clots and the clots can cause strokes. And he says, but we know we're monitoring all of that. And they were. He was hooked up to everything possible. Within a day and a half, he was off the ECMO. But what they discovered is that he had 2 strokes, you know, and his pancreas was inflamed. And it was just, they were trying to deal with one thing at a time, just trying to bring him back to me and my husband and my family. And they kept telling me he's a strong boy. He's very strong because just to, within 48 hours, to go through everything that he went through. And unbeknownst to me, they told me after all of this that they didn't even think he was going to survive, you
So,
know?
Beverly, we have a picture up.
Hmm.
Well, they had a picture up.
They had a picture up.
Put it back up, guys.
Okay.
So, I mean, this is Jordan, and
That's
you sent us
Jordan.
these pictures. So, when was this? Was this after the
This
heart
was right.
surgery or after
No,
the stroke?
this is before the heart surgery. This he was on the ventilator. He was on an ECMO. And for those, you know, this ECMO machine is basically a bypass machine. But for him, from what I was told, they had to go through his neck for this, and it was safer for him for them to go through his neck because they usually go through your leg. But what they found was for those who this is not even in the COVID area, but when they had to put people on ECMO machine and they went through their leg, later on in life, they would have to have their legs amputated. So it was safer to go through the neck. But by going through the neck, because it's so close to the brain, it can cause clots and that would cause a stroke. So I had to make the decision of where they would do it. And so they made the decision that that's where they would do it because it was best. So that was before the heart surgery. That's when he was hooked up to the ventilator, the ECMO machine. Oh, he also was hooked up to a dialysis machine because his kidneys was failing as well. So his kidneys was failing, his lungs was filling up with blood, his pancreas was inflamed. And then after the heart surgery, that's when they realized that he had 2 strokes, a minor one, and you know the one that left him paralyzed on his left side completely. And slowly but surely, you know, his vitals, his breathing, everything was happening on its own. He started to everything they started to decrease the medications, the ventilator. They took him off the ECMO first and kept him on the ventilator, and you know he was hitting peaks that they didn't think he would, and which was positive. So
Just
it's like, wow, yeah, wow, we didn't think he would come off that quick. So they took him off the ECMO, and then he said maybe in the next 5-6 days we can take him off the ventilator. But it was within 3 days that they took him off the ventilator because he was started just doing things on his own. The dialysis machine, it came off. So the only concern at that point was his strokes that he had, you know. But the night, because they took him off the ventilator at like 9:30 in the evening at night, and immediately, because they knew immediately that he already had 2 strokes, and they knew it was on the left side, and they started to ask him to try and move this and try to move that, and to see if he was alert and aware, and he was alert when they asked me to speak to him, and I went over to him and I said, "Jordan, can you hear me?" And he batted his eyes, and I said, "It's me, mommy. If I said it's me, it's mommy. Do you know? Can you hear me? Can you understand me? Can you see me?" And he squeezed my hand, and then the doctor said, "Jordan, can you smile for us?" And he did, and slowly but surely, he just, every day, hour by hour, day by day, I just started seeing my son come back to me, and I was so worried. I was scared because I didn't know what this stroke, I didn't know what effect the stroke had on him. And they said, they did multiple MRIs on him, and it was like every day, 2 or 3 a day, just to see what was happening. And he battled hard, and they said he battled hard. They called him their miracle boy, their miracle child. And it wasn't until afterwards that they told me, "Oh, we didn't think he was going to make it, but we didn't want to tell you that," And but he's strong, and he's here. And then 14 days he was in a coma, and he came out. He came out, and we spent another 7 days in the hospital, and then he was transferred to Blythedale Children's Hospital for rehab. And he's coming home. He's coming home 3 weeks there, and he's coming home Friday. So he'll be home, and he's walking. He's he still has issues with his left fingers, as it contracts from time to time, but he's working on that. And but he's back. He's telling me things about politics and watching the news, and he's watching everything. He's so aware. That was this morning. That picture right there was this morning. I took that up, and I told him, "You're going to get a haircut when you get out of here." That picture was this morning. So,
well, I don't know if you have anyone who can cut his hair, but trust me, I have some really professional barbers who are COVID free, who I'm sure would be more than happy to come and do a house visit to take care of them and get them all freshened and straightened up.
Yeah.
Charnay, I'm giving you a shout out, Westchester Barber Academy. We might need you to do a home visit, and Charnay has been a great partner of ours. And so trust me, if you want them all freshened up.
Yeah. He hates haircuts. He was like, I'm fine. He was in his glory that he didn't have to get a haircut. So he hates it. Yeah.
Beverly, you have been amazing. You, your husband, your son Jalen, your sister Sharon, you guys have been absolutely amazing. You shared your journey with us. And every day I stop to look at my Facebook page and stop to look at, because you would tag me at different times. Sharon would tag me. We would get updates on what was going on with Jordan. We prayed.
Yes.
Talked. So many people just continue to give encouragement on the internet, on phones and things of that nature. And we're just glad. We're glad that you're on this side of this journey now. It was hard. As a mom, I can't imagine what you went through. But I thank you for being so unselfish and sharing your journey with us on a day-to-day basis, and for being so transparent so we could support you in the only way that we knew how, through prayers and encouraging words.
Yes.
I
Yes, I
know
appreciate
the term thoughts and prayers has become so
Oh,
overused that there are people who are like, oh, we don't want to hear anymore about
but
thoughts and prayers.
no, but
But
it was prayers. It was prayers. I had everyone in Mount Vernon, Brooklyn, all over the country, all over the world was praying for Jordan, and it was prayers. I know it's modern day medicine, but they didn't even know. So I knew, though. We knew that, with the prayers that this would happen. But let me just say one more thing, Shawyn, that had I known, so Jordan did not test positive for COVID.
right,
He did not. He tested positive for the antibodies. My husband, who was very sick, also tested negative for COVID, but he tested positive for the antibodies. And my son tested positive for the antibodies. I tested positive for both. So I know that I was, the source of it for them. But had I tested Jordan for the antibodies earlier, I'm not saying that this wouldn't have happened, but maybe to the extent of what it happened, it wouldn't have been this bad, because immediately, as soon as he had that temperature, I would have rushed him to the hospital. But I didn't know that he, was positive for the antibodies. And that's what they basically spoke with me about with the hospital. If you test for the antibodies and you're positive, but you haven't had any symptoms, and especially the kids, because this pediatric multi-inflammatory syndrome, this is how it attacks them. This, it doesn't do it to the adults, it only does it to the children from what they've seen. And had I known that this would, like testing him, I would have been aware. I would have known. So I encourage every parent out there who has a child between 6 months, okay, because there were babies in there at 6 months, to 17 years old. You think of the COVID is not it hurts, but to get the blood work done, it's a simple 1, 2, 3 procedure. And I would encourage you to take your children to get tested for the antibodies. Because if it's positive, then they've come in contact with someone. And if they come up somehow with its temperature, what it could be and what to do. So I didn't know that. I know now, but thank God, I came out, my situation, my son's situation, was positive, and he's alive and, doing well. But for others, they weren't that lucky. But for my son, he was lucky. And I thank everyone in Mount Vernon for all the prayers. I thank you, Shawyn, for all the encouraging words and text messages, and just for everyone getting me through this, because it was not easy. It really was not easy. And I went through so many emotions. And so I am so thankful. I'm so grateful, and we're blessed, I have to say. And yeah, and I have to thank my church, St. John Paul and Clement, my priest, Pater Sabuni, because he was there every day. He couldn't come in the hospital, but he was there every day outside praying with us. And so, I'm so blessed. So thank you
you
all.
have an incredible network. I want to thank you so much for sharing your story and sharing Jordan's story. We're here and it's July 1st. And like I said, April 6th was the height of COVID in Mount Vernon. We saw 164 people test positive on that day. We were seeing on certain days upward, and Chief is here now, upward of 17 ambulance runs? 17.
Yeah, even higher than that, but absolutely.
High numbers of ambulance runs, high numbers of people in the hospital throughout the region. This was a time where Facebook, as Jackie Jones termed it, became death book, and all you saw was RIPs, RIPs.
Yes.
Pray for people. And, when you think about it, April 6th was what? Less than 3 months ago. Almost 3 months. It'll be 3 months on Sunday.
Right.
And at a time when everyone was, oh, wear a mask, social distance, stay inside, stay safe, be careful. Less than 3 months ago, when our community was being stricken in a way we could never imagine. And now the weather is warm. And now the coats are coming off.
Right.
And now the masks are coming off and not being worn. And now masks are available in great supply. But yet people have forgotten what our community was going through just 2-3 months ago. What advice do you have? I mean, you've already told parents, if you've had COVID, if you've had potential exposure, make sure you get your children tested for the antibodies. Because once you know if they have the antibodies or not, and you know about the inflammatory disease, then as soon as you see the signs of a fever or loss of appetite or red eyes or something of that nature, you're going to think not to just use Tylenol, but take them to make sure that they haven't, that they don't have the inflammatory disease. But what do you say to people in our community who are tired of social distancing, who are tired of wearing masks, who are tired of isolating, who want to go to the pool, who want to go to the gym, who want to go get their hair done and not wear masks, who want to shop, who just want to hang out in the restaurants and bars, the people who are tired of worrying about if COVID is an issue? What can you say to them?
I've been in the hospital every day for a month and a half with my child. And you're not if it's your child, you're lucky. You're allowed to, depending on the hospital, you're allowed to be there with them. But for you, you're alone. You're by yourself. They're not going to allow anyone to visit you and be with you. So what I would say, and I've told even family, please don't come to my home unless you've been tested. And if you were tested, just please come with a mask and gloves. Protect yourself. Do not take this lightly. This is serious. It is extremely serious. We all want it to go away. We do. But if you don't take the precautions as we're supposed to, it will never go away. And, I feel like sometimes people feel, well, it hasn't affected anyone in my family yet. But that day will come if, people continue to just go around without masks and without social distancing. That day will come. I didn't think this would happen to my son either. I didn't think, and I was taking precautions. I didn't think it would happen, but it happened. And I just ask everyone to please continue to social distance, wear a mask. It's something so simple, because in the hospital, when you're there, it's a must.
Absolutely.
Okay? It's a must. It is so I could not even leave my son's room to use the bathroom. They had a porta potty in the room.
Wow.
That's how serious it was.
Yeah.
Because we were contaminated. That's how they looked at us. You could not leave the room. Okay, until I got tested, he got tested, until it was both negative, They would not allow you to leave the room. So, it's serious, and you really need to wear your mask and social distance, as best as you can, but definitely wear a mask. They're available now. They're all over the place now.
They're everywhere.
You can get stylish ones, really nice ones. You put your name on it, everything. So you should. And because you don't want to go through what I went through. You don't. And I wouldn't wish it on anyone. Anyone. Okay, it's heartbreaking. It's heartbreaking.
So, I mean, I looked down for a few minutes because I was just looking at some of the comments on Facebook. And so people are just, excited to hear that Jordan is doing well, that he's coming back. Some people joined us a little late. So this is Vernon Hutchins. She is the mother of Jordan Hutchins, 8-year-old, who goes to Our Lady of Victory. And back on the 15th of May, Jordan began to experience temperatures of 101, 103, going up and down, responding to Tylenol. They lasted that Friday, Saturday, Sunday. You said on Sunday evening, his appetite decreased.
Yep.
And Monday, after coming back from a doctor's appointment, you said that he said his breathing
he couldn't breathe.
that, and
Too
you
well.
immediately took him to the hospital, and
Yeah.
by the next morning he had the red eyes, and they were putting him on a ventilator. So to have your child have a fever on Friday, Saturday, and Sunday, to take them to a hospital on a Monday, and by Tuesday morning he's on a ventilator, and by Wednesday on an ECMO bypass machine, now
But
needing heart surgery,
yes. Yeah.
and his lungs failing, and
Kidneys failing.
kidneys failing, pancreas inflamed, and then you said he had 2 strokes. I
Yes.
mean, I'm not hearing this story for the first time. We've traveled this journey, not as close with you, but we've been traveling this with you. But I'm just giving a little bit of a recap for people who are just joining us so they understand what we're talking about. And Jordan never tested positive for COVID, but you had COVID, your husband had COVID, your older son Jalen had COVID, and Jordan tested positive once getting to the hospital for the antibodies.
Right.
And so, you know, we had heard probably around late April, early May that I think it was probably, very late April, early May, right? That not just you, that there was something that was impacting the children differently. That they weren't necessarily getting COVID, but they were getting a whole different inflammatory disease. And just like Jordan's case, that's what we saw on MSNBC and CNN, that there were small children who 1 minute they had a fever and next minute their heart was failing, their lungs were failing, and they were in ICU. And so when we heard about Jordan, we realized that, wow, this was not just something on television. It became very personal because it hit us here in Mount Vernon. And as you stated, if you know parents that you've been COVID positive, or you don't know that you've been COVID positive, we've been encouraging people to go out and get antibody tests, not just for adults, but for your children. Because if you get the antibody test and you know you were exposed, then by great possibility, your children have been exposed. And if you know that they're antibody positive, and like Beverly said a few moments ago, if you know that your child has been exposed and they're antibody positive, then if they get a fever and start displaying some unusual symptoms, then you have to absolutely rush them. If you would have known, you would have been able to make a move at 24 hours or 12 hours. But what you didn't know, you couldn't do. But thank God that Jordan is recovering, that he will be home on Friday, and that we will be doing a celebratory drive-by and motorcade for him. But I know, you know, from the videos, because we get videos on your live page from Jordan. He says, I want to be home in time for my birthday. I don't want to be here. So his birthday's in August, so he's going to get an early birthday wish by coming home more than a month before his birthday. And he's going to be celebrated, and we'll get him that haircut. He may not like it, but you got to give him that choice. He's like, you know, a lot. You might have to let his hair grow out like Michael Jackson for a little bit. Just have a big old afro like the 80s.
But he would love that.
He would love it. He would love it. But we thank you so much for joining us tonight. We really
thank you for having me.
You sharing your story, and we continue to pray, and we ask that you continue to update us on Jordan's progress. And he is Boy Wonder, and we know that he is going to be up and back at it as never before. He's come so far. I have no doubt that he is going to go all the way.
Right. Thank you so much, Shawyn.
Thank you, Beverly. Take care.
You. All right. Thank you. Bye-bye.
Bye-bye. Thank you so much. So, I mean, that was Beverly Hutchins, mother of Jordan, and we're just so glad to hear that he is recovered. He is on the mend, and he will be home in less than 48 hours, in about 36 hours, and he'll be back home with his family. So we have our chief, Robert Odendo, with us. He is our chief of operations for the Mount Vernon Fire Department, and he has been leading our COVID response here in the city of Mount Vernon, with COVID being a medical issue, and our emergency medical systems and our emergency operations center operating out of the fire department. Chief Odendo served as the lead in helping us to develop and design our strategy to respond to COVID. And he has been an essential part of working with my office and Robin Mack and our essential business and reopening team and all of our departments throughout the city in making sure that as we reopen Mount Vernon, that we're doing it not just focused on our economy rebounding, but making sure that we are protecting the public health of our community. So Chief Odendo, where are we right now? Take us, where are we as a city right now?
Madam Mayor, thank you for having me on. I appreciate the opportunity. As a city, we're moving along. I'll say that, but I always think about using or becoming too excited too quickly.
Oops, I think.
And the problem here is that we are the interrelationship between the city, the state, and then the country. So although we may be a pocket that's doing well, we're still sort of held in check by what is happening nationally. So, big drive for us in our work with the emergency operations team is to constantly monitor and have that situational awareness at a national and even an international level, because again, what happens nationally and internationally is going to affect us locally. And right now, nationally, those numbers are not where we would like them to be.
Right now, nationally, we're seeing more than 30,000 new cases of COVID, I believe, a day. It's right. Almost off the charts.
It is.
We're seeing off the charts. It's record breaking. We know also that there is a cluster in Chappaqua. Someone went to Florida and they came back and they attended a drive-through graduation. And now more than 14 people, I believe, have tested positive in Chappaqua.
Correct.
Yeah, I believe it. Yeah, it is Chappaqua. Mm-hmm. So, where are we at right now? I said to the people earlier that we have probably about 2 positive tests a day. We're averaging about 2 people testing positive a day. Individuals who test positive are working with one of our local social service agencies and the Westchester County Department of Health to make sure that those individuals are quarantining, that they're isolating. We are working with the county and our local human services agency to do contact tracing to make sure that we contact anyone that those individuals who have come in contact with, and that those individuals are tested, that they are isolated, that they are quarantined for those 14 days to make sure that they're not potentially infecting anyone, even if they themselves have still not tested positive. We make it easy for people who are positive to stay home by making sure that they have food and medication, that they have their doctor support, and that they are meeting their needs. And if we need to, even move them out of their house and put them in another location so that they don't infect family members, especially if they don't have an extra room at home where they can social distance from their children and their loved ones. So, a lot of services are in place now that were not in place in March and April and May. And that's one of the reasons why we're able to kind of keep some of these numbers in check. But what we are seeing is, as the weather has gotten warmer and people have become more and more frustrated with staying at home, and as businesses are opening and you can go to the supermarket, you can go to retail stores, 4th Avenue, you can go and eat at your favorite restaurant. We're not at movie theaters, we're not at bowling alleys, we're not having concerts or anything of that nature, but about 70% of our society is reopened. And people really want to take advantage of that, but they are forgetting the importance of wearing their masks and social distancing. So, how are we dealing with that here in the city of Mount Vernon?
Well, you bring up a great point. So this whole phenomenon known as quarantine fatigue, we're seeing it firsthand in the city. I mean, again, nationally as well. And your last guest also kind of alluded to the fact that the level of complacency given the holidays, the season, and some of the other things that are coming into place, and the fatigue is having an impact negatively. That coupled with the fact that many cities, states are reopening, and a lot of the protocols that they've had in place for some time are being loosened or relaxed. It is a sort of a conflagration of a lot of sort of small variables, but coupled together can create a tsunami. And again, we are seeing the outcomes of that. For us in the EO, when we look at a day, when we look at numbers, we look at even the outcomes that we see right now, what we're actually looking at is what we did 4 weeks ago or maybe 6 weeks ago. So as we're starting to see numbers spike, we have to look at what happened. Where was the country 4 weeks ago that is causing this? And when we look back at the data, a lot of it looked at states that either weren't closing down properly or never committed to closing down or reopened too early. One of the things that we can say, and specifically in Mount Vernon with the EOC or the emergency operations team that we've operated with for the last 3 months, we took, I think we were very conservative. I think we were very proactive in many of the decisions that we made. I appreciate and I enjoy the fact that we used a village approach when combating the different issues that we were confronted with, and with the initial shutdown of the city, and then the subsequent phase reopening of that city. I think we did a good job, and again, hats off to the team for managing the data and the information and making informed decisions and not reacting to politics and the roar of the crowd, but instead listening to reasonable and sound information and making those calls. So I think that's the biggest thing. But I say that even with our best efforts, and we watched California, which was a state that had been very progressive and very proactive early on. Even with all of the good things that we've done, we at no time should we ever think to let our foot off the pedal. And I use that as an analogy to say that, there's still plenty of work to be done. And the minute that we let up, there's an opportunity for all of the hard work that we've done over the last 3 months to go away in a matter of a weekend. And we're really particular with this weekend, July 4th weekend, being an opportunity for us to lose some ground. So we really want to, enforce it or put out to the public how important it's going to be to continue to work hard, to continue to keep your family, keep numbers and gatherings low, wear your mask. And I mean, people are tired of hearing that, but unfortunately, until there is some vaccine or, protection at that level, your behavior is going to be what saves your life, probably more than anything else.
The biggest vaccine out here, like you said, is your behavior. And thank you for using that term, quarantine fatigue, because that's what people are experiencing. And so, like I said, we're seeing people not wearing their masks. I mean, for the most part, we see a lot of people wearing their masks. So I want to give credit to the many who are wearing their masks. Absolutely. Yes, there are some. There's going to be some everywhere. Mount Vernon, we are not a bubble. It's frustrating because no one's wearing their mask. No, there are a lot of people wearing their mask. And then there are some people who are not wearing their masks. And that is definitely very concerning. That is very, very concerning to us. We hear people, when are you opening the parks? What's going on? We need you to open the parks. Our kids don't have anything to do. They don't have anywhere to go. We are reopening our parks on the 7th of July. If all of the numbers continue to go well, we will be reopening our playgrounds. We will be having park activation programs Monday through Friday from 9 to 12, run by our Department of Recreation. So you can call 665-2420 to get more information about the park activation program. But then the playgrounds will close for about an hour and a half to 2 hours throughout the city and reopen from 2 to dusk to give us an opportunity to sanitize the equipment and let the young people go in there and play again. We still are telling people you have to wear masks, you have to social distance. We will take several of the play pieces out of service to make sure that there is some social distancing. But other than that, it's really at your own risk. We don't have the resources to put workers in the parks all day to watch children play and monitor parents who should be bringing their children to the park to make sure that their children are wearing masks. So really the only thing that is going to protect us from major spikes in COVID happening again is, like you said, people wearing their masks, people social distancing, washing your hands, sanitizing equipment. We continue to sanitize public areas, bus stations. We have as we said, an essential business and a reopening team that really focuses on compliance of the business. So can you talk about what we're doing insofar as making sure that businesses are in compliance? And we're not getting to every business every day, but we are working on that. The compliance team is comprised of the fire department, the police department, the building department, emergency operations department. Those are the primary people who are on the business reopening, and then also our economic development team in the planning department. And we're ensuring that that businesses are in compliance with the state regulations. So if you can talk about that a little bit.
Sure, absolutely, Madam Mayor. So the business reopening started first as the essential business reopening, or task force for the essential businesses. At that time, we were just monitoring businesses that the state had deemed essential to make sure that they were following the protocols and that they were doing everything to maintain safety, for their staff, the limited staff that they did have on premises, as well as the customers that were coming in. As the governor's order worked through the different phases, we also modified our responses and our objectives to meet that demand, and started to monitor now all the businesses as they reopened. This task force was the initial objective of the task force was to assure compliance, and we went back and forth with even what that might look like. Typically when you think about government, you're thinking about enforcement and punitive actions taken when people don't listen to or follow the law. But that wasn't the objective of our task force. Essentially, what we're looking to do was to get out, to have some sort of rapport with the business owner, to sort of, and the mayor talks about this a lot, hear their heart and understand that their position. They had gone months without being able to earn money and pay many of the bills or sell their merchandise. So there was an issue with them having income. There was an issue for the city not being able to collect sales tax. Got a lot of priorities that we had to sort of address, and we unpacked them, and we did that. But it started first with developing a system where we would go out and speak to the business owners, let them know that we were here to help them. We wanted to partner with them and and have a partnership in assisting them with reopening. And then once we did that, to usher them through the different steps, be it sanitizing and cleanliness, be it how many staff members they could have in the store, be it barriers and signage to speak to the different needs that would have to be in place for that establishment to be open. And then the great part about this is that, and as negative an impact as this pandemic has been on this country, the city specifically, we're always looking for an opportunity. Not that we're opportunists, but we're looking for an opportunity to move Mount Vernon forward. So in looking at some of the historic issues with property maintenance and code violations in the city, we are also going to use this opportunity to leverage some of the talents and the team that we have to address code violations, property maintenance issues, and just the aesthetics of the city. We understand how important that is to economic development going forward.
Thank you so much. The team has worked very hard. Malcolm, if you have the graphic that shows our testing rates and our EMS responses over the past few months, if you could put that up. So what we've talked about is, this is a road to recovery, but we are not at all celebrating. We're not celebrating because COVID is not here. We are happy that our numbers are down, but every day we're all very, very tense, and we're watching to see if numbers are going to begin to creep up as businesses open. People said, oh, now that the hair salons are open, numbers are going to increase. We haven't seen that. But we continue to work with the hair salons. We encourage anyone you know, that if you go into any business, restaurants, auto body shops, salons, supermarkets, retail stores, and you see that businesses are allowing people to come in without masks, you know, report that information. The fire department has a hotline at 914-665-2626. Is that right, Chief? 914-665-2626, where you can report businesses that are not following CDC guidelines insofar as requiring customers to come in with masks, if their staff are not wearing masks, if social distancing is not being practiced by these businesses, then you can call in. If you see large groups of people who are gathering and they don't have masks, large groups. Now, I'm not talking about 3 or 4 people who are hanging in front of a bodega. We just don't have the manpower to be full-time social distance police. And, you know, another challenge that we're dealing with right now are fireworks and noise complaints, because people are home. Like you said, people are dealing with quarantine fatigue. And because there are no outlets like movie theaters, malls, gyms, bars, clubs, you know, entertainment places, a lot of people are trying to find ways to kind of get rid of all of this frustration that they have about having to stay at home and not have anywhere to go. And so we are seeing more backyard parties. We are seeing, you know, people gathering in their driveways or in front of their houses. And we are seeing groups of people gather and not always wearing masks and being very close. Mount Vernon, you know, we are no different than the rest of the country. And as people have reversed their behaviors and gone back to pre-COVID ways, we've seen big spikes in the numbers. So now California and Georgia and South Carolina and Florida and Arizona and, you know, over 30 states right now are all now going back into quarantine or closing down their businesses. We have so many people who have already lost their jobs, and our economy is just starting to rebound. But if we are not vigilant in practicing social distancing and practicing wearing our masks and continuing to wash our hands and understand that this is still very much a public safety threat, then we too can see ourselves experiencing the same fate that we're watching on television. We don't want to go back to this. One of the things that we are additionally challenged with, and this is not to scare you, but we've been struggling and dealing with Mount Vernon Hospital closing since October of last year. And the capacity of the hospital, even during COVID, was very, very minor. It was minimal. They had 12 ICU beds and about, I believe, 45 regular beds, about 57, 58 beds altogether. Right now, in the past 2 days, they've closed the ICU unit. There is no ICU unit at Mount Vernon Hospital. They continue to transfer physicians out of the hospital. They are continuing to transfer services out of the hospital. And, you know, while we are fighting to keep it open and while we're fighting for it to be upgraded, they are a private institution and the state has not put the brakes on them closing. So, you know, Montefiore Mount Vernon continues to let go of services. Like I said, there is no intensive care unit there. There is no longer a medical intern program there. There is no longer a medical surge program there. And so should COVID come back and hit our community, the hospital that was barely able to meet our needs in March and April is going to be less able to meet our needs. And so we need for people to contact not just your city council and your mayor and your county legislators, because we're pushing for this. We need you to contact Senator Bailey. We need you to contact Senator Biaggi. We need you to contact the Senator Stuart Cousins and our Assemblyman Carl Heastie, as well as our Assemblyman Gary Pretlow. We need you to reach out to the governor's office. The work is not yet done. We cannot afford to lose our hospital, even if it is functioning, you know, under resourced. We can't afford to lose it. We can't afford to lose it right now. You know, this is we're talking about social justice, and we're talking about violence. Montefiore looking to close and continuing to close the hospital in the middle of a pandemic is beyond racist, is the very epitome of structural racism and institutional racism, and it's very irresponsible. And I can't even believe that they're allowing this to continue to happen. So,
Madam Mayor, if I could, 2 points with the hospital. One of the metrics that's used to understand your a city or a community's ability to handle COVID is your ICU capacity. So, Mount Vernon will be at a point soon, and we don't know what COVID will look like in the fall or even next week, but there will be an opportunity, or there'll be a point in Mount Vernon where we will.
Oh goodness, you're freezing.
Your comments, well, I'll just go to New Rochelle, or we'll just go to Bronxville. Well, let's think about that, reasonably for a second, and logically. If we add 10 to 15 minutes, and we talk about transport as an EMS agency, if we have to add 10 to 15 minutes to your transport time forget about COVID, a heart attack, a stroke, or some serious or critical care issue, that is the difference between life and death. And again, that is impacting Mount Vernon, residents of Mount Vernon, majority brown and Black people. These other, and then we let's go out one more. We transport to a Bronxville or New Rochelle. Now we're including our capacity with these cities' capacity. Is that even going to be a reasonable thing to do? And then the level of service and care. We're going to another municipality and expecting them to treat the resident. Not to say that they would not do that.
Montefiore's research said that Mount Vernon is a medically underserved community
and human nature.
So if your report is saying that Mount Vernon is medically underserved, then how do you believe that closing the hospital is going to improve our level of service? Yes, I, like many residents here in Mount Vernon, are unsatisfied with the level of service and the quality of service that we've received from Mount Vernon Hospital, because it's constantly been deprived of fair and equitable resources. And so, yes, you can say that anything is dying if you're slowly poisoning it. And that's what we've seen over the past 10 to 15 years. When it was owned by New Rochelle, they took resources out and then they blamed the community for not using the hospital. When Monty picked it up and promised to provide all of these services, they continued to take services and resources out of it and blame the hospital. And that's what they do now. Right now, New Rochelle Hospital, because of COVID, supposedly is not delivering babies. And so, Mount Vernon residents who were going to New Rochelle to have their babies now have to go to St. John's Riverside in Yonkers, which is already managed by Monty. And it's not clear if New Rochelle's labor and delivery unit is going to reopen. And so Monty is regionalizing their system of care, which means that they're decreasing and the services available in each of the hospitals and making the different hospitals a specialty. But we know that their capacity to really serve this region is being diminished. And while Mount Vernon Hospital might be the first to close, we need to pay attention, because if you allow Mount Vernon Hospital to close, then soon you're going to allow St. Joseph's in Yonkers to close, and then you're going to allow New Rochelle to close. And then, what's going to be next? And the profit of this private hospital and their real estate desires and their desire to make more money for their stakeholders cannot be leveraged against the health and the welfare of a community. Again, we're talking nationally about structural racism and social justice, and this is a violent act. We can talk about police brutality. This is medical brutality, leaving a community without comprehensive health care and taking the certificate of authority, because it's not just that they're looking to close our hospital, they are taking the license to have a hospital in Mount Vernon, and they are going to give it to New Rochelle and expect them to take care of us. So if we lose the certificate of authority, then that means we can't even recruit another hospital like an NYU or a Presbyterian or a Northwell or any of these other hospitalization organizations to come into our community, because they're going to take the license for the hospital along with them so that there's not even an opportunity for competition. So this is a violent act. This is nothing short of violence, medical violence against our community, you know, and we have tried to be, we have worked very hard, tried to work with Monty. Our elected officials have reached out to our officials at the state and asked them to put a stop at this through the State Department of Health. We have not heard back from them. They have not been responsive. And we really need, you know, the citizens of Mount Vernon, you can be quiet about this. We get a lot of people saying, oh, Mount Vernon Hospital is garbage. Mount Vernon Hospital is not great. We know that you're not satisfied. We're not satisfied with the hospital, but there's a difference between having a hospital that's not so great that we can work to improve and not having a hospital at all. If you have no hospital and you have no ability to recruit a hospital, then we forever lose the only hospital that we have in the community. So yes, while you may not be pleased with the hospital, that doesn't mean that we forfeit our right to have a hospital. And that's what people need to understand. This is not just about Mount Vernon Hospital closing. It's about us not being able to replace it with anything. And so we need to wake up, stand up, step up, and really, really bombard the state and ask them to intervene in this. This is structural racism. This is irresponsible. And Mount Vernon, if we don't fight now, and if you as residents don't stand up and help us fight now, there is nothing that we're going to be able to do. We're almost at, it almost feels like we're at a point of no return with the amount of services that they've taken out. But if we really come together and we lift up our voices, we might be able to stop this. If Montefiore leaves, at least the state will not allow them to take the certificate of authority, and we'll have an opportunity to go out and recruit another hospital. So I think that that's what we need to focus on. And we will be sharing more information with you, but we are working with our city council. We are working with our state senate and our state assembly representatives. Congressman Engel has been working with us on this. I spoke to Megan in Senator Schumer's office today, and they're federal legislators, so they don't necessarily have much to do with the hospital, but we're asking for everyone to weigh in on this. Our county legislators have been working with us on this. Our county legislator, Lyndon Williams and David Tubiolo, they've been working with us on this. If we don't stand up now, then there won't be any options left. So like I said, a bad hospital that we can work on improving is better than not having any hospital at all. So we have to get together and we have to push together. This is not about politics. This is about the public health of our community, and making sure that we are, that we're able to provide care for our people in our own community. It's really important. So Chief, I know we're at the end of our time. Is there any more information that you have? Look, Mount Vernon, Wilson Woods opens tomorrow. Wilson Woods Pool opens tomorrow. And county legislator is going to come down. The county executive is going to come down tomorrow and open up the pool. But even in going to the pool and going to when the parks reopen, and when you're having your cookouts, when you're shopping, when you're going back to church, some of the churches are reopening. We cannot let our guard down. We can't. We can't. So Chief, back to you. Any closing thoughts?
I will just echo what you're saying. That's where we are, Mount Vernon. We have to stay vigilant. We have to be smart. We have to think. And I know there are a lot of reasons not to, continue to follow social distancing and wear your mask. It's sad, even, and not to digress, but it's wearing a mask has become a political issue, a political position. I mean, the virus that we're dealing with does not understand our emotions, our politics. That's not where we're going to be able to overcome this thing. If anything, it's forcing us, as the mayor has alluded to work together, to think more in terms of community and village and less individual. So let's take some of those lessons from that. Be close with your family, make sure your family's safe. But we have a duty. And then the other point, if we understand that the demographic of this city, and we understand that the hospitalization rates for COVID 4 to 5 times higher for Black and brown people, there is a duty and a responsibility for us to really make sure that we're doing everything that we can to keep our families safe, keep our block, our neighborhood safe, and our city safe. So I would beg, at this point, the citizens of Mount Vernon to please, especially this weekend, wear your mask, keep your gatherings, close, tight, get tested if that's the case, but be vigilant, be smart, and don't be duped into thinking this is not a big deal, because that's a quick way to the graveyard.
And we will end with a positive note. We were accepted into the Harvard University Bloomberg Philanthropies U.S. Cities Leadership Program for the social and economic recovery of communities who have been impacted by COVID, and that's all across the country. So it was a competitive application. Chief, I want to thank you for probably putting together about 90% of that application, and really digging in and drilling in and doing the research and taking and drawing from the lessons learned over these past 3-4 months, and our entire team who put that application together. But we will be participating in this national leadership project with Harvard, with Bloomberg, and with Johns Hopkins University and Medical School out of Baltimore, to really look at the steps that we need to help our community recover financially, but also socially, emotionally, and making sure that our community is safe and that we are engaged with our residents in transforming our community and helping us understand how to operate in this new normal. So thank you so much, Chief, for joining us tonight. Thank you again. Thank you again, Beverly Hutchins, for coming in and sharing your family story and letting us know how Jordan is doing. We want to welcome him home on Friday. We're looking forward to that celebration. And everyone, we're asking that you please be safe during this holiday weekend. Please remember your neighbors. Please, please, we urge you, we beg you to cut back the fireworks. It's very dangerous. We're seeing fires in Yonkers. We're seeing fires in New York City. These are dangerous. And I know that this is part of this quarantine fatigue, but the impact that it's having on your neighbors, our seniors, our veterans, our children who can't sleep at night, animals, people who are experiencing PTSD. We have to do better, Mount Vernon. We absolutely have to do better. This is not an issue that we're just facing here in Mount Vernon, but it is an issue that we're facing throughout the state and actually across the nation. But we have to do better. We can't worry about what's happening in other communities, and we can't arrest people and imprison people to get out of the firework challenge, or arrest our way out of COVID by arresting people who are not wearing masks. This is not the way we're going to do it, but it is the community, policing the community, that is going to help us move forward and help us be a resilient community and a strong community, and a community that puts forth best practices. So Mount Vernon, if we do this together and we move forward together, then we'll succeed together. Thank you, everyone. Have a blessed night. Take care and have a safe weekend and holiday weekend. Be well.
Be well. Thank you.
Thank you.